Hello, everyone. My name's Will McDonald. I'm ambassador for the Prostate Cancer Foundation of Australia. We'll get to my story in a little moment, but I want to thank you all for joining us today for a very important discussion about the Prostate Cancer Foundation of Australia's Prostate Cancer Specialist Nursing Service. Now, prostate cancer is the most commonly diagnosed cancer in Australia, accounting for 16% of all cancers diagnosed and for nearly 1 in 3 cancers diagnosed among Australian men. And yet, the nation only employs one specialist nurse for every 239 newly diagnosed men. Now, today, we really do want to shine a spotlight on whether a prostate cancer patient really needs specialist nursing support, the difference that specialist nursing support can make, and what can go wrong if we don't have the care of, I'll be honest, these wonderful nurses who have helped me quite a lot. Today, I'm honoured to be joined by Adjunct Professor Sara, who is the Director of Nursing at PCFA. Sally has over 35 years of nursing experience and heads up the charity's Prostate Cancer Specialist Nursing Service, which currently supports 114 of these specialist nurses. Welcome, Sally. We have Paul Fenton, CEO of Icon Cancer Centre across Australia and New Zealand. Now, Paul has spent more than 20 years' experience working across the public, private, and not-for-profit health sectors, and as a qualified radiation therapist. A big thank you to Paul for joining us today. And Jim Lloyd, he was diagnosed with prostate cancer 20 years ago and has been involved with the PCFA ever since. He's also a former Minister for Local Government, Territories and Roads, and a passionate advocate for men impacted by prostate cancer. Once again to Jim, thank you so much for being on board. Now, for me personally, specialist nurses have played a really big role in my life. I was diagnosed with advanced aggressive prostate cancer at the age of 42. I've seen firsthand, I've experienced firsthand what it's meant to have a prostate cancer specialist nurse who is there that I can ask questions to. Prostate cancer is a complicated, difficult, confusing disease, and the treatments can come with all kinds of side effects. So I'm just been so thankful in my experience that I've had a team there that I can call on pretty much whenever to help get through some of the, I'll be honest with you, dark times. So let's get on to the first question that we're really going to tackle here. Do men with prostate cancer need specialist nursing support? Well, more than 26,000 Australian men are newly diagnosed with prostate cancer every year. There's a sad statistic, nearly 4,000 of our fathers, brothers, grandfathers, uncles, friends, colleagues will die from the disease. There are now more than 250,000 men in our community alive today after diagnosis. And as I mentioned, many of them are dealing with complex treatments with life-changing side effects. Are we doing enough to support them? All right, Sara, Director of Nursing at PCFA, let's start with you. Talk to me about this patient care gap. Now, I mentioned one nurse for every 239 newly diagnosed men. Can you tell us about the PCFA's Prostate Cancer Specialist Nursing Service and how the model of care has evolved over your time?
Do you know, Will, there are over 400,000 registered nurses in Australia and only around 120 trained prostate cancer specialist nurses. So there are care gaps all over the place, both in regional and metropolitan areas where we don't have a prostate cancer specialist nurse at all, areas where we have a part-time nurse but desperately need a full-time position, and then in major health services where we might have one nurse but we really could do with 2 or 3 to meet that increasing demand. Regional areas particularly underserviced, and we know that men diagnosed with prostate cancer in a regional area have a 24% increased risk of dying from the disease compared to those living in metropolitan areas. So in terms of our service, it was established, our health service-based nursing program was established in 2012 with a pilot program. And in those early years, the focus was really on supporting newly diagnosed men, helping them through treatment decision-making, the treatment itself, and then some support in the early months that followed. but we recognised really quickly that prostate cancer treatments pack a huge punch in terms of the physical and psychological effects, and that burden extends really well into the months and years that follow. So we've worked really hard to develop our model of care around that. And it's really like no other. We link in with men as close to diagnosis as we possibly can, preferably on the day if we can. And we really stay in direct contact for around 2 years if we can manage it. And then after that, men can remain in contact and call nurses if they get into difficulties indefinitely, really. But as you said, with one prostate cancer nurse per 239 newly diagnosed men, that caseload keeps growing, and it risks the intervals between those contacts pushing out and men missing out on that vital support. So really, in contrast to the statistics you were quoting, in Australia there's around one specialist breast cancer nurse per every 48 newly diagnosed patients, which is a huge contrast to one prostate cancer nurse for each 239. So yes, many care gaps to address, and we're working very hard to address those as best we can.
Yeah, absolutely. I know the hard work that you do. It's phenomenal, and it's really good to have that perspective as well. And just a comparison. Breast cancer patients deserve the best treatment, along with prostate cancer patients who deserve the best treatment possible as well. I'd like to bring in Paul Fenton from Icon Cancer Centre. You're a national and international leader in patient-centred care with prostate cancer specialist nurses inside Icon centres around the country. Now, what difference do these PCFA nurses make to the work that you do, and what's the importance of having nurses in your centres to help patients?
Yeah, perfect. Thanks, Will. There's no doubt the impact of the PCFA specialist nurses is highly valued. Icon has 300 of its own nurses in their cancer centres, but they are focused on supporting the care within the centre. The value of the PCFA specialist nurse is that, as Sally said earlier, is from the start of the diagnosis and then supporting that patient from there all the way through. Australia is blessed with a very great healthcare system, but it can be complex, and then navigating that, the role of having education and being part of a complex choice that patients are faced, and no one can be prepared for that. So the quality of the experience, the feedback that I get from patients is how much of an impact the specialist nurses make for them. It's extraordinary. So absolutely a very, very valued and an important part of the team at Icon Cancer Centre.
Yeah, absolutely. I do agree that first up appointment, that first up kind of advice, just to help some of those questions that you may have forgotten to ask when you're in those early appointments. It's amazing to have a PCFA specialist nurse there. Jim Lloyd, now you've been involved in this for a long time, because you were diagnosed with prostate cancer, 20 years ago? Do you agree that we've come a long way, but what sort of extra priority do prostate cancer patients need in terms of specialist nursing?
Yeah, thanks, Will. It's now 23 years since I was diagnosed, and yes, we have come a long way from the treatments, and there was no prostate cancer specialist nurses in my day, but they are just so valuable. I mean, the diagnosis of prostate cancer is such a tricky thing for men. You know that, I know that, because there's so many options out there. Basically, you empower a man to make decisions. Now, men aren't very good at making decisions about their health treatment. Whether you have surgery, whether you have radiation, what the side effects are, the continence, the erectile dysfunctions. I mean, your head is spinning, and to have the prostate cancer nurses there that can work through with the patient is just invaluable. It's life-changing, and it makes such a difference. I can't emphasize how important these prostate cancer nurses are, and why have specific prostate cancer specialist nurses? Because it is a specific disease. It's unlike many other diseases where you are diagnosed, the surgeon or the doctor, the specialist says, right, you're coming into hospital, we're going to do this. End of story. You don't have a decision to make. You just have to treatment. But this one is so complex, and it mentally is so draining for men and so complex, because you're talking about the continence, the erectile dysfunction, the manhood. All of a sudden, your whole manhood is threatened, and you need someone to guide you through that minefield. So yeah, look, it's changed an awful lot. Didn't have it. You've experienced how valuable they are. In the role that I have with Mates Connect and the prostate cancer support groups, every single day men are just saying, they keep saying, these nurses are just angels. They are just amazing. So yeah, they're very valuable.
Yeah, couldn't agree more, Jim. Thank you. Your experience is one that's so good to have here with us today. Yeah, you're spot on. You can survive the disease. You can be treated successfully, but have these horrible ongoing side effects, and that's what we need help for as well in many cases. Now, what makes these specialist nurses so special? This is really something we want to touch on today quite specifically. The Australian government report into building the evidence base for a national nursing workforce strategy admits that the value of nurses is not fully recognised, which is really unfortunate and disappointing, and that the important work that nurses undertake is not always fairly valued. Sara, I'm certain that you're going to be able to add a fair bit more to this. I mean, I'm going to assume you agree on that front. And what work is PCFA doing in this space to improve the recognition and importance of these specialist nurses and the barriers that still exist to getting more so?
Well, prostate cancer specialist nursing is highly specialised. That's why that word specialist is in the title, and it is highly specialised because, as Jim said, prostate cancer is a very complex disease to treat, and our nurses really play a vital role on the front line, really, of our health system. They're an expert point of contact for men and their families. They're an integral part of the healthcare team. They're often the first point of call when things go wrong. They increase treatment and surveillance regime compliance. They reduce numbers of missed appointments. They assess for and address issues early, reducing the chances of men ending up in the emergency department. And in addition, many nurses now also undertake post-treatment PSA surveillance in lieu of a medical review, which saves thousands and thousands of medical appointments in a health system that's already overloaded, and frees up specialists to see more new patients in an earlier time frame, which helps shorten waiting lists and that sort of thing. So yes, I do agree. No surprise that the work nurses undertake is often not fairly valued, which is why we at PCFA commissioned a study through the University of Queensland, actually looking at social return on investment for our program. And that report really highlighted the tremendous financial benefits for placing specialist nurses in health services, and really strong productivity gains. And it showed that for every dollar invested, there's $1.62 social return on investment. And our model of care really highlights that advanced scope of those roles. And we continue to make representation to government outlining the benefits of our nursing program, not only just to men and their families themselves, but also overall to the health system. And that's why really recently we called on the federal government to make a $7.7 million investment over the next 3 years to bring on an additional 21 nursing positions. Now, that would have been a good start, but in reality, we really would need to double our program to even get close to meeting the need or to reaching every man dealing with the prostate cancer in this country. And there hasn't actually been any new government investment into increasing positions since 2020. So we really, in some ways, are failing men and their families in this country who don't have access to, as Jim said, life-changing support that a specialist nurse brings.
Yeah, that's a very good point you make, Sally, in terms of there's an upfront cost. There always is, but the not only financial benefits, but the social benefits are massive on the back end. And I think we really need to make sure people understand that. So that's really good to hear those details. Jim, you were a serving federal government minister for quite a while back in federal government. Now you were the chief whip. Now, what more has to be done, I guess, in terms of a policy principle to make sure that everybody embraces that best practice nursing care and every man gets the best chance of having the support that he needs? Does it have to start at the federal government level? Do we need better policy levers?
Yeah, look, it does have to start at the federal government level. I mean, basically, that's the level of government that funds most of the prostate cancer specialist nurses. You need to continue what we're doing now. We need to push the value of the nurses, quantify that in the survey. So Sally said, for every dollar they spend, $1.62 back in value. And you've got to also personalise that to understand that many men are being diagnosed at a young age. You said yourself 42, I was 48. We're right in the middle of our working life that contributes to our families, to Australia's economy, that sort of thing. Now, if we don't support the men through that struggle of prostate cancer and we lose them or they're not able to continue working, then in a dollar sense, that's costing our economy a lot as well. So it's not just the personal side of it as well. And governments talk dollars. So you really have to say, look, if you're going to invest in this level of healthcare in prostate cancer nurses, this is the return you're going to get. You're going to save on other medical services. So talk dollars in that sense. The other thing is we really have to drive home to the government how efficient the system is that we have now with our prostate cancer nurses. The way it is run through Prostate Cancer Foundation of Australia and through the coordination through Sally and all those nurses is efficient. We can prove that it's efficient, and we have to make sure that the government gets that message and continue that we are cohesive in what we're doing. The worst thing you can do for a government as a minister is to come in with fragmented advice from different groups saying different things, and that's where you end up in trouble. I think we are very coordinated in what we're doing with the prostate cancer nurses, and we have to continue that message and continue forcing the value that we have out of the prostate cancer nurses so the government actually understands it is a very good investment in a dollar sense, but also in a humanity sense as well.
Yeah, very well said indeed. I agree. We're pushing that message. There's no doubt about it. Paul Fenton from Icon Cancer Centre, your services that you provide, obviously world-class. Would it be exactly the same? Would it be as holistic? Would it have an impact on your centres if you didn't have prostate cancer specialist nurses within your centres for men and their families?
Sure. Well, it's where we've got the prostate specialist nurses embedded in the centres that absolutely a vital part of the overall team. And it's interesting when Jim talked about fragmentation is that I think that what they are offering is not just that patient experience, but that continuity of care and really reducing variance of care. And so there is a situation that's really called out today is an inequity of access for those patients that don't have ready access to prostate cancer support nurses. Icon has seen the value and we are investing in these roles. We're going to add more roles into our centres across the year because they have just continued to be so valuable to the patients that we're all here to serve. So from our perspective, they are one of the most effective ways to elevate patient care, get consistency. And it's not just through that, through the treatment phase, which we do, but I think from that diagnosis, but also then through into survivorship and looking to make sure that these men are supported to transition back to that new normal.
Yeah, it's wonderful to hear. There's going to be more within Icon Cancer Centres as well, Paul. Thank you. Now, I guess it's really important to touch on what can go wrong if we don't have prostate cancer specialist nurses for, let's be honest, and ideally every man who is going through this. Myself personally, look, I count myself as one of the lucky ones. I've had a wonderful range of support, and I've always kind of known where to turn, and I've been fortunate. I had a really bad situation, but I do feel that I've been mostly very well looked after in every sense. But having said that, it's been horribly difficult in many ways, physically, mentally, the emotional strain on my family. I still get a regular call from my prostate cancer specialist nurse, and there's always a question that crops up. There's always something that I haven't been, or I should have been thinking about and haven't been thinking about. So it's wonderful to have that as well. This is where I want to bring in Sara again. Talk to us about the cost of prostate cancer on men and families and our health system. What does the data tell you, and how important it is to have these nurses to help alleviate some of that?
Well, as you well know, personally, prostate cancer comes at a huge cost to men and their families, debilitating physical, psychological and sexual side effects, treatment costs, loss of income, travel and accommodation costs, and the prostate cancer and its treatments can take a massive toll on quality of life, contributing to high rates of anxiety and depression, and for men and their families, feelings of fear and grief and loss of hopes and dreams. And in addition to that, prostate cancer actually brings a huge cost to the health system as well. It continues to be the most expensive cancer to treat in this country, represents an annual $1.8 billion health burden, according to the Australian Institute of Health and Welfare. And from our statistics, around about 85 to 90% of our caseload is dedicated to supporting existing patients, caring for high numbers of men continuing on treatments or plagued with long-term debilitating treatment side effects, with a really strong focus on assessment and management of the psychological burden that prostate cancer brings with it. We provide expert training to our specialist nursing cohort with an internationally renowned psychologist who specialises in prostate cancer. That's quite a unique thing to our program. And with a 70% increased risk of suicide attached to a prostate cancer diagnosis, it's imperative that we have nurses embedded in our health services that are trained to care for men dealing with the aftermath of this disease.
Absolutely. I couldn't agree more. And I just want to kind of point out a little bit about the treatment. There's lots of people who probably know about surgery with prostate cancer, and you have your prostate removed, and that can help a lot of people. It helped my dad. He's been clear as a bell for 5 years. But then there's people like me who were diagnosed at a late stage. I didn't have surgery, but I had chemotherapy and radiation therapy. That was fine. But for the past 5 years, I've lived on a thing called hormone therapy. And it's a bit of a misnomer. I don't get hormones. I get all my testosterone taken away. And that causes havoc in every sense of the word, physically, mentally, emotionally. So that's why we need support. That ongoing treatment is huge for people like me. I take a medication which is horrible but keeps me alive. And I just need help with that a lot of the time. Jim, you've been involved in PCFA support groups for a number of years now. How important, just from a grassroots level, boots on the ground, how important is it to have that kind of integration of not only of care, I guess, between the nurses and the peer support groups, so men have that ability to turn to other people, but also have some specialist nursing as well that they can just call on?
Look, it's critical, and we're working continuously to ensure that the support groups are aware of the prostate cancer nurses and vice versa. It's great in many cases now the prostate cancer nurses do attend the support group meetings on different occasions, and the support group meetings are amazing. The support groups, the volunteers, and they helped me a great deal in the early stages when we didn't have prostate cancer nurses as well. It's that face-to-face meeting, and they can talk about their own personal experiences, but they're not qualified in a medical sense to give advice, and to be able to then refer someone to the prostate cancer nurse to let them know that they're there, to give them that extra level of advice is just critical. And we've still got work to do on that. We've still got to make sure that all the support groups are very much aware that if they have a prostate cancer nurse in their area, the support groups are very important in the regional areas. And in some areas, as Sara said, we don't have a prostate cancer nurse. We do have now the Prostate Cancer Specialist Nurses teleservice, through PCFA as well, which is amazing. So we're making sure that the support groups that may not have a nurse in their own geographic region are aware that they can simply ring PCFA and get linked up to a prostate cancer nurse on the phone as well. So yeah, it's amazing. They're working really well together, and we'll continue to reinforce that message with them.
Absolutely. And great you gave a shout out to the telehealth nursing service as well. I know someone very close to me who is going through a really, or had been through a really difficult period with prostate cancer, and the telehealth nursing service was wonderful for them, as well as the actual nurse in the centre too. Paul, how important is that connection to the best practice care close to home, like what ICON can provide, and then the overall survival rates in a context here in Australia?
Well, the data is out there. Proximity to healthcare services matters. For every 100 kilometres away from home, from a centre, it's about 10% decline in patient outcomes. So we've invested heavily in providing regional, rural, and out of metro care. And what that shows, I've spent my entire career in cancer services, either working in regionally or now sort of leading services. And I go out to sites and I hear the impact that being able to stay home, not having to leave home to go have your treatment, has a huge impact on the communities that we're here to serve. The overlay of the prostate support nurses, though, again, it just means is that there's that continuity that we've heard about, that being that connection and demystifying the complex health system. And for us, that best practice care being part of a comprehensive, connected care service, it really does drive patient outcomes.
Yeah, I agree. I count myself as one of the fortunate ones. All my care was close to home. It was relatively easy, but it wasn't easy. It was still difficult. So I really do advocate, and this is why I'm here. I really do advocate for the men who don't have the fortunate experience that I did while going through a really difficult time. So I want to make sure that everybody gets the same level of care. There should be no variances. I'm passionate about that, and I'm glad that there are so many people fighting for that, like us here today, and the PCFA as well. Sally, I'll turn back to you, and we'll start wrapping up shortly. But I'll turn back to you. How can men and their loved ones access PCFA support? Also on the specialist nurses, how do we get in touch with them? And I suppose, how far have we come in the PCFA and providing specialist nursing? Also, what is your ultimate goal for the future?
Will, the establishment of our specialist nursing program 13 years ago, and then our in-house telehealth-based nursing and counselling service a few years ago, is something at PCFA that we're incredibly proud of. And I'd encourage anyone with a question or concern in relation to prostate cancer to give us a call through at our nursing and counselling service. It's 1-800-2200-99. It's free, it's confidential. The lines are open Monday to Friday. Now, that service will be able to provide support right there and then on the line, but also if there are prostate cancer specialist nurses near the location that anyone's calling from, the 1-800 service will link them in to local nurses as well. And sometimes people call through and they've been diagnosed with prostate cancer and treated a decade ago and actually aren't aware that there's someone in their local region. So it's a bit of a hub and spoke model, that service. And really, on reflection, there's no other program like ours in the world offering expert clinical and psycho-oncological support from nurses that are specially trained in screening and managing the impacts of prostate cancer in men, and also taking into account those masculine behaviours and traits that are so often a barrier to accessing support or asking for help. The bottom line is that we need more prostate cancer specialist nurses embedded in our health services and treatment centres. And my vision really is that every man dealing with prostate cancer in this country and the family and support around them has access to a prostate cancer specialist nurse closer to home. It's so important, as Paul was just saying. And really that support, for me, my goal is that that is provided irrespective of geography or treatment type or health insurance status, so that no one goes without the support of a specialised prostate cancer nurse as a primary point of contact when and where they need it.
Yeah, and a big shout out to all the people who are supporting men with prostate cancer too. You touched on this. Prostate cancer and the side effects that men suffer affect wives and partners greatly. And I know that prostate cancer specialist nurses can help them through this period as well. I want to get a bit of a wrap-up closing statements from each of you. Jim, I'll start with you. What do you think is going to be the best outcome for men? What's your last message to make sure that we can continue this program?
I guess the best way to sum it up is when men have treatment for prostate cancer, that's not the end of their journey. That's the start of their journey. They have surgery, they have radiation, they have hormone treatment, whether it's a metastasized cancer or whether it's a local cancer. It's the start of the journey. And, I know myself, I'm talking, nearly 23 years ago, I'm still on that journey. Every time I go and get a PSA test, I'm still worried, will it come back? I had radiation, 15 years ago. I still have emotional issues. You never, that journey never ends. While ever you're alive, you'll be on that journey. So you need support. And to have the prostate cancer specialist nurses alongside you for that journey just makes such a difference. I can't emphasize how much of a difference it makes to know that they're there. You may only talk to them once a year or once every 5 years, but it's when you need them, when you hit the wall sometime as a man, to have that support there on the end of the phone is invaluable. From a government point of view, they need to wake up and listen to the fact of how valuable these prostate cancer nurses are in person and on the phone, and support them. And, I'll do everything I can to continue to see this service continue, flourish and expand for all the thousands of men out there who need that service.
Here, Jim. Very well said. Very well said. Paul Fenton from Icon Cancer Centre, what's your message to people out there listening and about the prostate cancer specialist nurses?
Well, I hope that anyone listening today, the take-home message is that there's no doubt of the value that the prostate cancer specialist nurses have for patients diagnosed with prostate cancer and their family. I think that we need to address the shortfall. And so, as Sally opened with, the ratios aren't where they need to be. And there is a huge opportunity for us, huge opportunity for government to fill those gaps and really serve the men that need it most. So I think I'm really passionate to make sure that collectively the partnership that Icon has with PCFA couldn't be stronger. And so we're here willing and want to be part of that future for the men of Australia.
Excellent. Thank you so much, Paul. We really do appreciate your support too. Sally, Sara, last word to you.
Thank you. I'd just like to take the opportunity to thank and pay credit to our incredible prostate cancer specialist nursing network across Australia. The nurses that we support work incredibly hard. They're highly skilled. They're dedicated to what they do. And they really make an incredible difference to men who are living within the communities they serve. To men and loved ones out there who may be listening, please, if you have any questions or you need support, give us a call on our 1-800 number, 1800 22 0099. We are here to help. Really, we exist because of you and we exist for you. So please reach out and we will link you up with nurses closer to home if they're available, or we'll provide support through our central telenursing network. And as everyone has said, we will continue on working very hard to shore up our prostate cancer nursing network and increase the numbers so really we can hopefully our vision can be realised where no one walks alone dealing with this disease. Thank you.
Yeah, absolutely. And I just want to say I'm one of the probably few prostate cancer patients who has met almost every single one of the PCFA specialist nurses. I was honoured to be able to speak to them at a training conference a little while ago, and I can see firsthand each and every one of them were just so passionate about what they do. Afterwards, we spent just You could have stood there for hours talking about the cases that they've worked on and the passion to learn more and better ways to support men. So I know firsthand, literally from pretty much every single one of them, how passionate these prostate cancer specialist nurses are. And I know how much they've helped me as a man with prostate cancer. And firsthand, I've seen it happen as well with people who are close to me who I've referred to the service. So thank you all so much. I think to sum up, there's a massive benefit for the medical well-being of men. There's a massive benefit for the mental well-being of men and their partners and families. There's also a massive financial benefit that comes with having prostate cancer specialist nurses readily available to deal with some of the complicated and difficult treatments and side effects for men. So I think it's obvious we need more prostate cancer specialist nurses, and hopefully we can see this program expand and grow, and as Jim said, flourish. I want to thank you, Sara, Director of Nursing at the PCFA. A big thank you to Paul Fenton, CEO of Icon Cancer Centre, and Jim Lloyd, former federal government minister and also prostate cancer survivor and a big supporter and ambassador for the PCFA. Thank you all so very much. My name is Will McDonald. It's been wonderful being able to host this webinar and just provide a lot more insight into the wonderful work of prostate cancer specialist nurses. Thank you.